Hi, and welcome to Detours Understanding Acquired Brain Injury. Um, so I wanted to talk about diagnosing brain injury, about acquired and traumatic. A lot of people, and I'm going to touch on some stuff I've touched on before quickly. Um, the CT scanner and MRI are not diagnostic alone. You also need information from the patient, family, and you also need often testing to be firmly diagnostic. A lot of people say, well, gee, the MRI didn't really say much of anything, the CT scan. They don't, because they are good for determining whether surgery is necessary, or that's why they're done quickly, is because they can show gross anatomical changes. But usually they're not sufficient alone unless something significant is changed. But you then might need neuropsychological testing, might need testing in the doctor's office, testing by the neurologist, and family to report what happened to make a complete diagnosis. But you won't see hard evidence, just some circumstantial evidence on the MRI. Even with diffusion tensor flow, MRIs, or functional magnetic resonance imaging, or PET scanning, or SPECT scanning, that alone is not sufficient. In order to make a firm diagnosis, usually it's patient history and it is neuropsychological testing that is necessary to make a firm diagnosis. I just wanted to touch on that. I've seen people say, well, gee, the MRI didn't really show much of anything. No, it won't. It could show loss of white matter. It can show changes in density due to diffuse axonal injury and Wallerian degeneration. But alone, it's not enough. And the CT scan, even less so. It'll tell them they need to operate right away because of midline shift or bleeding in the brain. You can see one of my videos where I talk about this. But really, you need a lot more than what you could see on those kind of scans. And that's why. And that's why testing, neuropsych testing, is often necessary. And that's why a thorough family history is necessary. And concussions, things like that, will show nothing oftentimes on the CT scan. The reason they order those is to make sure you don't have a bleed. And that's why. So just wanted to touch on that. Hope you have a good day. Bye.